quite the title of our talk is supposed to be why your doctor doesn't know, because your doctor never learned. Your doctor doesn't know how to detox people off of alcohol and opiates and benzos because they've never done it. They never learned how to do it. They have very strong misconceptions, but not because they don't care and not because they're great doctors. And I have wonderful doctors in our community who are absolutely phenomenal clinicians who refer people to me for basic alcohol and opiate and benzo detox because it's just not something they have time to do, not something they're passionate about. There's not something they know about. I mean, think about it. Anything else, right? Like if your car needs a transmission, you're going to go to a transmission place where they just do transmissions, and they've done transmissions for 20 years, and they could probably do it smoother and faster and easier. And you could go to an oil change shop, and maybe there's a guy who could figure it out. And I feel like that's kind of what we're doing with substance abuse. You're going to your primary care doctor. And the other thing is, having done a lot of sort of case reviews and legal reviews and worked for different people and answer questions, most of the providers, most of the docs and prescribers at treatment programs, whether it's methadone treatment programs, whether it's, a $10,000 a day by the sea treatment program, these guys they're family practice docs, they're mid-levelers, they're nurse practitioners, they're PAs, they're anesthesiologists, they're optometrists. I mean, they're people who hey, you want to make a few extra bucks and prescribe some meds? I mean, from what I've seen, they're not board certified addiction medicine physicians, psychiatrists, for the most part. Again, there's certainly some exceptions, but your average doc prescribing at a drug and alcohol treatment program is usually a semi-retired family practice doc or something similar. It's just not something that they just have a ton of experience with, and they do the best they can. But people, I think, and of course with the whole history of rehabs over-promising and under-delivering and then taking your whatever they shake out of your wallet, I don't think that everything's really well aligned. So that's kind of the summary. Why your doctor doesn't know anything is because they just haven't done drug and alcohol treatment a whole lot or experienced it themselves or just had a passion about it.